everybody. Thank you so much, Heather and Heidi. That was an awesome presentation. It's going to be a hard act to follow. So as Heather mentioned, I'm the clinical medical librarian at the University of Toledo. And some of you may know this, or you may not. The University of Toledo entered into an affiliation agreement with the health system. And one of the things that makes this agreement unique is that they entered into it for 40 years. So we are in a situation where we need to not only provide access to online journals, online books, et cetera, for all of our health science students, undergraduate students, but also this ever-changing group of affiliated faculty members. So today I'm going to try to give you the big picture of a study I did in 2018 and 2019. And actually, I started it because I was confused. And I really didn't know a lot about the various options and the legalities and access issues involved. So perhaps you'll get something from today, and I hope you enjoy it. So I decided to do a mixed method study about 2 years into my time at the University of Toledo, because I didn't understand how my library was making decisions. And I thought, well, maybe it's just my university. So I came up with a short number of questions and interviewed 7 decision makers at public, private, large, and small universities. I also hoped to interview hospital librarians, but that didn't work out. And based upon those decision maker responses, I drafted 3 different models. The collaborative model, which basically means one library makes all the decisions and either everybody agrees to it or nobody agrees to it. A standalone model, which we use at the University of Toledo, where the library pretty much makes the decision that works best for them. And this can mean if they have a great fiscal year, they subscribe to a whole bunch of things. If they don't have a good fiscal year, they start canceling things. And then the mixed or the hybrid model, which was the most popular. The hybrid model means that they work in a variety of ways to maintain access. So it could be through a grant. It could be a department saying, hey, we really want this. Let's give you the money to do it. So after these interviews, I realized I didn't have enough information. And there were just some big questions out there that I still wanted to get answers to. So I created survey questions and obtained institutional review board approval. And then in the spring, I completed the data. So based upon the decision models, most people right now are doing the hybrid model. The fewest number of libraries are doing the completely collaborative model. And the standalone is kind of in between. It's the middle group. And I would anticipate the completely collaborative model to grow over time. And I sincerely hope that the standalone model ceases to exist, but we'll see what happens. So then I asked the study participants, okay, so how is your library funding these subscriptions? Well, in the graduate programs, they rely heavily on electronic books or the single online journals for the various department specialties. And then they use the big deal options to cover journals from, say, Nature or JAMA or other groups where it just makes more fiscal sense to get a whole bunch of journals at once instead of to pay in a piecemeal fashion. So I was not exactly surprised to see that most of these were funded by the library. What I was surprised to see, however, is how people anticipated paying for these subscriptions in the next 5 years. You will see, if you notice in this likely column, that the library is still anticipating paying for everything. This was not, in my opinion, a feasible solution in 2019. And with COVID, it's still not a feasible solution. So what on earth are we going to do about this? So the takeaways I've drawn so far from COVID-19 are we really have to prioritize the electronic access. So that medical students will be on campus for 2 years if I'm lucky, which means for the following 2 years, when they're out in the clinics, they need the electronic access. So that's why whenever I can, I try to make sure that we have electronic access, even if it's a single user license and somebody gets kicked off because we only have one copy of it. At least they have access at some level. We also really need to communicate. I transitioned to creating specialty databases. And when COVID hit the fan, I basically spent 2 weeks just putting everything I possibly could by the various specialties I support into this LibGuide so that they could go and more easily find it. Especially with the tough fiscal times at the University of Toledo, I'm sure we're not the only ones, but we've basically had a flat or declining budget for the past 5 years. So the temptation is really high to cancel, and I get it because you can immediately save the money. The problem is once you cancel that subscription or you pull out of a big deal or something else, it becomes that much more challenging to renegotiate a contract, especially with the priority of electronic access and accessibility. And I'm also beginning to question the feasibility of relying on interlibrary loan and document delivery. Yes, they do save us money in the short term, but in the long term, if we looked at all the data points, maybe it would make more sense to not be so hasty with canceling the journals and instead paying a little more and using our interlibrary loan statistics in a slightly different way. So Heidi spoke to some of the issues surrounding open educational resources and textbook affordability. I would love to see more open educational resources available for the health sciences, especially at the graduate level. But right now, it's just a really hard sell because you have to have money. And if you're already in a fiscal situation that's not pretty, trying to talk that faculty member out of the lab to create the textbook and hire the support people to do it, it's just not possible for us. So my current strategy is to go out and find the open educational resources, suggest it to the faculty members along with the subscription resources that we have, and then let them make the decision. Because ultimately it's their choice. I can only support them. Another component of this is the open access dilemma. So perks to open access. Everybody goes, wow, open access, it's great. Well, it is. Articles are immediately available. The library doesn't have to pay. And they offer really good turnaround times. But then I start thinking about the challenges. So who's going to cover that article purchasing cost if it's not provided by the library through a subscription? Is the journal even listed in the directory of open access journals? And by the way, if you look at the directory of open access journals, you're going to notice that a lot of journals are no longer able to keep publishing and maintaining previous issues because they just do not have money. If a journal is affiliated with an organization or association, usually the article purchasing costs will be lower and they may give some benefits to members, but again, there's that cost if you have to join it in order to pay for it. Also, who's indexing the journal? If it's just in Google Scholar, I hate to say it, but I'm probably not going to pay a lot of attention. If the journal has an impact factor, then I'm going to be more likely to pay attention to it. And then depending on where the faculty member is when they're looking to publish, I may say, hey, you have a credible publishing record. Why don't you try this higher impact journal first? And if they say no, we'll rethink it. And last but not least, who's serving on these journal editorial boards? They keep asking me to serve on journal editorial boards for journals that are beyond my area of expertise. So that's something to consider as well. So to kind of finish up here and to put a positive perspective on it, what's our role? I've just filled you in on all the challenges, but we really can do a lot, especially our liaisons. I think we really need to focus on building upon our existing relationships. So if you can be a part of new faculty orientation, do it. If you have an opportunity to meet with new students, or returning students in any capacity, even if it's just waving at them in the hallway or organizing therapy dogs if they're stressed out. It's one way to get your name out there, and then you'll start hearing about the issues. It also just takes time. I don't think it hurts to explain the challenges the library is facing, whether it's challenging license agreements, funding, staffing, you name it. If you're on a committee that's outside of the library, make sure they know what's facing the library and what they could potentially do to assist us. I do think, as I mentioned earlier, that we need to rely on more than one source of data to assist in making data-driven or evidence-based decisions. And whenever you can, especially if you're in a situation where you're serving multiple people and they always keep turning around for new opportunities or new jobs, new faculty orientation, et cetera, make sure they know who you are, what the library can do, and bottom line, that you were there for them. At the director, dean, and associate dean level, they are in levels that we as the liaisons and the support people really just can't enter. But I would hope that they would start collaborating with other decision makers, recognizing the shared interest at either the consortium level, professional association meeting levels such as this, so that we can all come to a better understanding and I hope in the future create some solutions to these issues. If this talk has been interesting to you, I did go ahead and write a full article on it. I'm happy to share it with you. Thank you so much for coming today, and I think I'm out of time.
Thank you, Margaret. I wanted to open it up for questions for Margaret. Feel free to put them in the chat, or you can unmute your mic and ask Margaret. Give you a little time to put your thoughts down. I have a question on, can you expand your comment on ILL?
Sure, I can try. So right now, the primary way the University of Toledo provides access to any article, just like any other library, is to rely on interlibrary loan if we don't have the full text journal. What we could potentially do with interlibrary loan is offer something called a rapid ILL or some other options. The challenge is if you're already in a fiscal situation that's bad, interlibrary loan costs are the cheapest option. And if you add speedier options to deliver the article, at some point, the cost of the interlibrary loans over the periods of years will probably net out to being equivalent or close to it to the online journal subscription. It would take a long time, but eventually those two are going to equal out. So it's really a challenge of figuring out what the faculty really need and what you can offer via interlibrary loan. I hope that makes sense.
Okay. And I have a comment from Amy. We have found that ILL requests don't really go up when you exit big deal packages. Cool. Any other questions for Margaret? Okay. So I will take the rest of the time. We still have a few more minutes we can open up the floor. I know that there was some questions for Heidi. I'll go through. It looked like some of the questions were the same. So I'm not trying to take them out of order, but I was thinking we'd answer Julie's question first on what was your budget for this program?
Sure, and I messaged Julie directly, but it's $15,000 to $20,000 out of our collections budget per year.
Okay. And then now I'm going back to Stephanie's question on if you could speak a little more on the controlled digital lending portion of your program, and if you've run into any issues offering that service. It looks like that was also mentioned by Robin and Julia.
Sure. So our CDL program could have its own full presentation at Miala here probably. And I don't oversee that program. Affordable textbooks are the textbooks that we have as part of this program were just included. I can summarize it briefly. So we only provided controlled digital lending or electronic loans of things that were on reserve in print. If there was an option for us to buy it electronically, even if it was something that we didn't have electronically, that was not a candidate for CDL. We didn't scan everything that was on reserve. We looked at those things that were commonly used or most frequently used, and that included a lot of the affordable textbook titles. We have Microsoft 365 at MSU, so we used SharePoint, and one reason we used that is because our systems team was able to offer a very locked down copy of the textbook, meaning the student couldn't copy, couldn't highlight, couldn't print, couldn't share it in any way. And the loan was typically for whatever the reserve items loan was. So once the link was sent, it expired 2 hours or whatever the loan period was from that time. So it's our circulation and reserves team who have been overseeing that program. Our head of circulation is Erin Weller. She's fantastic. So if you have any questions, I'm sure she'd be happy to go into more detail, but hopefully that's enough of an overview to answer most of those questions.
Thank you. Are there any other questions for either presentation?
I have a question. This is Tina. Heidi, I'm wondering if there were very many publishers who offered that kind of closed reserve system.
I'm sorry, Tina, what was the second part of it, or what was the question? If there were publishers who
were there many publishers? Like, who were the publishers who were willing to do that, to allow students to give or sell the library an electronic version of a textbook and then allow students to check it out electronically for 2 hours?
So we didn't get publisher permission for the controlled digital lending program. We had our copyright office and general counsel's office kind of look at the program, and since it was due to COVID, there weren't any issues from our end because it was so locked down. We haven't unfortunately been able to really work with publishers to get us electronic copies that they'll sell to libraries. So a lot of the publishers are really trying to market electronic textbook purchases or rentals to the individual student. So we have been able to just by chance find a few textbooks. And I say, well, textbooks, they're just required materials for courses. They're less of the typical, Psych 101 textbook, but they might be a book that's just being offered as a textbook that falls more into an ebook category that we have been able to purchase. When that's the case, we do, and we try to buy unlimited copies or unlimited users, but that's not always possible. So sometimes we're buying multiple 1-user copies or a 3-user copy and looking at usage as we go along.
Okay, thank you.
Okay, any other questions? Okay, and it looks like Julia shared a link on controlled digital lending, as well as Heidi just shared a link to her Google Slides. So you can access them there. If we have no further questions, thank you everybody for attending this breakout session. Be sure to leave your feedback on each presentation by going back up to the conference portal and going to the event surveys tab, and each session will be available to provide feedback. And thank you everybody again, and our next round of breakout sessions will start at 3:45. So thank you.
Thank you, Heather.
Thanks.
Great job, Heidi.
Thanks, you too.
Thank you. Nice to meet you.